What is the Delta variation of COVID? The World Health Organization has another naming framework, utilizing the Greek letter set, for COVID variations of concern. The Delta variation was recently known as the Indian variation, as it was first found in quite a while. It's one of 3 sub-genealogies of the Indian variation, and is otherwise called B1.617.2. It's more irresistible. The Delta variation has been recognized in various nations across the world, including the UK, US, Fiji, Singapore and now Australia. In the UK, Delta is outcompeting the Alpha strain, in the past known as the UK variation. This by itself recommends Delta is more contagious than Alpha, which is fundamentally more contagious than the first strain originally recognized in Wuhan, China. Are there more cases in kids? It's difficult to address this inquiry with sureness. Victoria's Chief Health Officer Brett Sutton said there are recounted reports of Delta being more contagious in kids. This equivalent speculation was coasted when the Alpha variation was first getting predominant in quite a while of the world. My lab has as of late researched whether Alpha repeats better in the cells of youngsters and discovered it didn't. We haven't had the option to test the Delta variation in our lab yet, however I'd treat this thought with alert, for 2 reasons. The first is that the strain is likely more infectious in general, which could be prompting more cases in children. Also, furthermore, kids haven't been inoculated, though numerous grown-ups have, which inclinations the information. Our antibodies actually function admirably against it. Some data suggest Delta can dodge our resistant frameworks. This is surveyed by taking a gander at the quantity of antibodies in immunized individuals, then, at that point perceiving how well those antibodies kill the infection in the lab. In reality, there is a drop-off in immunizer protection with this variation. Nonetheless, the vital thing to note is that a drop in antibodies in lab tests doesn't really seriously upset immunizations. Lab results ought to be treated with alert. The uplifting news is our present yield of COVID antibodies actually remain moderately successful against Delta in reality. Information from Public Health England found one portion of AstraZeneca or Pfizer was 33% powerful against the strain, yet 2 dosages was 60% and 88% viable. What this shows is we can't depend on the main portion alone. Everybody actually needs to ensure they have their subsequent portion.